Welcome back. Gastroenteritis. Can you take this pretest first with answering whether this is a false or true statement? Rota virus is the most common single cause of gastroenteritis in developed countries. Treatment of the cause of gastroenteritis is the most important line of treatment in gastroenteritis. Oral rehydration therapy decreases the prevalence of gastroenteritis. Laboratory workup for a cause and complication is mandatory in all cases of gastroenteritis. Keep your answers till the end of this session, then you'll find out whether you were correct or not. Let us start with this case scenario. A mother came with an infant 8-month-old complaining of watery diarrhea 8 times in the previous 24 hours with 5 bouts of vomiting. His temperature was 38.7 degrees Celsius rectally, and on examination, he is lethargic and irritable. Sure, this is an acute infection. It started rapidly and progressed rapidly. It contains vomiting, and vomiting is caused by a stomach disease. And this, as you know from your pathology course, is called gastritis. And diarrhea usually arises from intestinal involvement, so it reflects an inflammation of the intestine that is enteritis. Hence, the name called gastroenteritis. You should define things first. For the first moment, you'll say gastroenteritis is well known. How to define it? It should be an acute infection of the gastrointestinal tract that can occur involving part or whole of the tract. Although this is precise definition, however, it usually presents with diarrhea, with or without prominent nausea and vomiting. So the cornerstone in the diagnosis usually is diarrhea. So let us define diarrhea. In fact, although it is easy in teaching, in practical situations, it may vary. So you'll find the definition in 3 items. It should be frequent passage of liquid fluid or liquid stool. And by definition, liquid is something that can take the shape of the container. So it may be liquid like the water, it may be liquid like a soup, it may be liquid like a semi-formed, but a little bit it can take the shape of the container. So there is a variable degrees of liquidity. It should be large amount. However, how much frequent is frequent? We now knew how much liquid is liquid, but how much large amount is large amount. In cases with breastfeeding, frequent passage will vary from those on formula feeding. For example, in formula feeding, anything more than 3 times is high frequency. But in breastfeeding, we can find normal frequency up to 10 times per day. So, in breastfed infants, the definition of frequent stool passage is more frequent than his normal habit. But regarding the amount, we have a problem. Because one motion may be large and others are not, so that the total amount of losses are not very large. This drives the scientific community to use the terminology purging rate. And purging rate is the amount of stool per kilogram body weight of the individual per 24 hours. And we can classify the amount of losses into mild, moderate, or severe loss. We will give more hint on this in our face-to-face session. Actually, in some developing countries, they used a semi-quantitative definition of mild loss, moderate loss, and large loss, and we can give a hint about this in our meeting in the face-to-face session. It should be an acute diarrhea, and by definition, acute diarrhea is something that started acutely regarding the onset and should resolve within 14 days. And because sometimes we are confused in some conditions in which diarrhea may occur for more than 14 days, may occur for 1 month, for example, and we have two possibilities of this: continuing pathology occurring on daily basis, or a pathology that comes and goes all through the month. So the scientific literature started to ask when we can say that this attack finished and we are now having another attack. They use the terminology episode to define this area. An episode of diarrhea is the period between the first motion fulfilling the criteria of diarrhea till 2 days from the last motion fulfilling this criteria. So there should be 2 days of the definition to say that this episode has finished. Actually, from the epidemiologic point of view, they are using the episode terminology to differentiate between the load of the disease in different countries. For example, in Egypt, the episode rate is 3.6 episode per individual member below 5 years per year. And in some other countries, like Far East, they may have China and India, they may reach up to 7 episodes per year per member below 5 years. And in some other developed countries, the rate is 0.2. Now you can differentiate with this definition the load of the disease in different countries, and we can follow up the improvement facilities in one country over years by the same definition. Unfortunately, this episode rate in Egypt was the same like in 80s. What is vomiting? That is expulsive extrusion of the fluids, contents of the stomach to the outside through the mouth. So anything easy is not called vomiting. Anything that is not associated with contractions of the extra gastric muscles like abdominal muscles is not called vomiting. Anything that comes from a gastrostomy tube is not called vomiting. What are the possible causes of vomiting? This will be discussed more in year 6. This diagram demonstrates how is vomiting happening, what are the stimuli for this vomiting to occur, and the medicines that are usually used to counterattack the different pathologies so that it can be used as therapy. Why vomiting can occur? You can prepare an answer in gastroenteritis. You can prepare your answer to be ready for the face-to-face session.